like to refer to page 10 of your slides now. We'll move on to the second trimester. Now, the second trimester is considered week 13 to 27, and in many ways we call this the golden trimester. So the reason for that is at this stage, hopefully nausea and fatigue will have subsided. In most cases it does. However, things like cravings can be more frequent in pregnant females. So once again, we'll go through a few of the conditions that can happen to the pregnant female, but once again, reiterating that it doesn't happen in every pregnancy and every pregnancy. So the first point we'll talk about now is upper back pain. So as the abdomen grows to accommodate the growing fetus, what happens is your costovertebral joints become in an unnatural position. So if you can imagine that the mother can become quite kyphotic and hunching forward, which can cause upper back pain. The second one here we want to talk about is lower back pain, and probably this is more common, we find in our experience, is that lower back pain it is worse, and that's due to the extra weight and strain on the lumbar. It causes the lower back muscles to become sort of tight and overworked, essentially. The reason for that is, as I mentioned earlier, your uterus grows and your rectus abdominis becomes misshapen, and therefore it's not functioning properly. And obviously the load has to go somewhere, and quite often it does go to the lower back. Once again, we'll talk about exercises to counteract that later on in the course, but essentially just strengthening up postural chain right the way throughout. Once again, we'll refer to the exercise section later on in the course, and we'll show you how to do that. Things to consider as well, if they are suffering from lower back pain, is postural cues are so important. Postural cues such as pelvic tilt. If they're suffering from upper back pain, then focus on retraction exercises. Obviously, the weight distribution is going towards their anterior, so things like quadricep strengthening will help. What we would say is week 16 is quite an important week in the mother's pregnancy from an exercise perspective. And one of the reasons for that is obviously because of this lumbar weakness. What we would say you'll need to avoid is any overhead pressing. Okay, so any military press or shoulder press. Now at week 16 is the time to take that out. Moving on to the third point there is sacroiliac pain. Once again, due to the effects of extra load and the relaxin in the system, if mothers are suffering from sacroiliac pain, we would say you want to avoid loading the hip asymmetrically and avoiding jerking motions, once again, such as plyometrics. So, for example, if they are suffering from any sacroiliac pain, walking lunges would probably be out of the question. Any plyometric jump lunges, for example, would also be out of the question. I want to move on now to a condition that's called diastasis recti, or diastasis recti now. This condition, once again, generally tends to present after week 16. The studies show that it occurs in roughly 30% of pregnancies, but from my experience, I would say it's a lot more, and to some extent, all mothers suffer from it to some extent. So, what is diastasis recti? Now, diastasis is essentially, in its simplest form, a separation of the rectus abdominis from the midline, the linea album. Now, how do you know if they've got it? Now, essentially, if a client presents with diastasis in a severe case, it can come out as sort of a pyramid that protrudes from the midline of the rectus abdominis. Particularly if they're wearing tight clothing, for example, in the gym, and they brace in a brace position, that's when you can see the protrusion. Okay. Now, diastasis, essentially, we'll show you the self-test for it later on, but if it is above 2 centimeters or roughly 2 fingers in width, then it's going to need addressing. If it's less than that, chances are it will go back to its natural form postnatally. In some severe cases, it can be up to 4 fingers or more. If that is the case, they can lead to surgery or an abdominal brace, which is similar to a corset and is not particularly comfortable. Now, the condition itself, it isn't painful for the female, but it isn't. It's not very aesthetically pleasing, and it can cause a few issues to their core region during and postnatally. If you have a client who suffers from diastasis postnatally, and they come to you 1 year postnatally after birth, so the condition, unfortunately, it can't be reversed. The collagen in the muscle has reformed in that unnatural position, and unfortunately, it can't be reversed. So, the implications to diastasis. What we would say is, if you have a client suffering from diastasis, you want to avoid any excessive abdominal work. So after week 16, you would stop crunches, for example. And what we would do instead is focus on the TVA, the transverse abdominis muscle group. Once again, we'll show you how to focus on that muscle group later on in the course, in the exercise demo section. But just focusing on that TVA instead of abdominal work. So, other things to avoid are any heavy loading and any standing rotational work. Again, it's the rectus abdominis is misshapen, it's separated from its natural position, so it's not functioning properly. And you don't want to be working muscle groups that aren't functioning properly. Now, we'll talk you through quickly the diastasis self-test. It's now very important to note that this test is outside the scope of practice for personal trainers. So we'll teach you it. We feel that it's important for your clients to know so that they can be aware of the condition and if they have the condition. But just be aware that it's outside of the scope of practice for personal trainers. For the self-test, what you're going to ask your client to do is lie flat on the back with one knee bent and the other one straight out on the floor. You're then going to get into place one hand on the head and the other hand on the abdomen around their belly button. You're then going to get them to make sure they're relaxed to start off with. They're going to gently press their fingers into the belly button, and they're going to crunch up, bringing their shoulder blades towards their pelvis. What we'll get you to do then is get them to move their fingertips backwards and forwards across the midline, test the severity of it. As I mentioned earlier, it can be 1, 2, 3, 4 fingers, even more in some cases. And the condition is always most severe at the belly button region, which is why we test there. But it can obviously occur right the way up the midline, above and below the belly button. So moving on to another condition that you need to be aware of in the second trimester, which is known as supine hypertension syndrome. Now, after week 16, what you want to avoid is getting your clients to lie flat on their back on a hard surface for longer than 2 minutes at a time. Now, the reason for that is, obviously, as your abdomen grows, your uterus grows, it becomes heavier. And if you are lying flat on your back, it restricts the blood flow distributor for the vena cava, which is the main blood flow distributor back to the heart. Okay. Now, with supine hypertension syndrome, what we would recommend is that you reiterate to your clients, if you are mentioning it to them, that it's on a hard surface, so that if they do go home at night, they're not worried about lying down on the sofas or in bed. If you do have your clients in the gym, for example, it's okay to pop them up on an incline to do an exercise, a chest press, for example, but we would say just avoid getting them lying flat, hard on the surface. And just finally, once again, we've got a few slides here about how the baby is developing. We won't go through those in detail, but do have a look through them.